The World Health Organization is urging citizens in China to return to masking and social distancing protocols and get a vaccine. They don't say which one.
Just get any of them.
Oddly enough.
Just go get one.
Because they don't know what the heck this is. It's hilarious that we're going to see how little they know about this, how thin their evidence is, what crap organization they got it from, but they're saying get a vaccine, but they don't say which one. It's almost too good to be true. So what are we supposed to think here? Well, I think there are a few things to look at critically. One, China is saying this is not a serious outbreak. Now, recall, China said that about the COVID-19 pandemic, and that turned out to be valid, right? I think that now we can agree that the world overreacted to the COVID-19 pandemic and made many mistakes based on anti-China sentiment. Would you agree?
Yes. I think so.
We know now that we hurt children with lockdowns. We hurt people with mask mandates. We hurt the general population with vaccine mandates. So here's an idea. Maybe this time we listen when China says we don't think it's that serious. I don't know. It's just a thought. I'm just putting it out there as a thought experiment. Now, the WHO, the World Health Organization, told us that the COVID-19 pandemic was life-threatening and serious and made us all mask up and distance, and they never apologized for what research they didn't have and were not following. So how can we trust them? Well, let's take these things in reverse. Now, first, here's the statement from the WHO on what they're calling clusters of respiratory illness in children in northern China. They explain what they think this is and what China has said about it. And then here at the end, they say, here's what they recommend we should do, is that people in China follow measures to reduce the risk of respiratory illness, which include recommended vaccination, keeping distance from people who are ill, staying home when ill, getting tested, and medical care as needed, wearing masks, good ventilation, regular hand washing, all of that stuff. Now, vaccination, what vaccination? They don't even know. It's just like get some vaccinations. Do regular vaccinations. And pick one, anyone, right?
So if I step on a rusty nail, that'll help me against this thing?
Yeah. I guess
I'm
any
going for the
old
rabies one.
Okay.
Rabies.
Leishmanosis.
Leishman's. Isn't that a dog disease?
It is, and so is rabies.
Okay.
But, they're saying get vaccinated. So here's what they say they know about this. Now, it looks like, okay, those are thick paragraphs. They must know some stuff. They don't. So here they are quoting this media and ProMed. Who the heck are those people telling us?
ProMed?
Oh, I'm going to tell you who ProMed is. But also media, okay, are reporting clusters of undiagnosed pneumonia in children in northern China. Now, I want to know, how do you report undiagnosed pneumonia? How do you know if someone's not been diagnosed?
Or if I don't know,
and they're just walking around. Do we have this social monitoring in place?
Like if my daughter is fine, she's walking around. Do I just call up and I'm like, I'd like to report my daughter has something. I don't know what it is.
They're diagnosing remotely, and I'm going to show you this. Go ahead, Philip.
Well, it's getting on the media part. Like, is the World Health Organization? It's supposed to be that the media. That they report on things that come from experts, not the other way around.
Yes.
That is bizarro world. Like if the health experts are like, well, what does CNN say about this? Oh, okay, that must be true.
Right.
What in the hell is that?
Yeah, what's Anderson Cooper have to say about this new disease? Let's check in with Cooper first before we report this.
You guys are on the right track. That's absolutely what I want you to see from this. Now, notice they're saying media, which is strange, right? But then they say ProMed, as if that's something we should know and have learned from. Now, we've been covering the pandemic intensely for the last 2.5 years. I have never seen anything sourced from ProMed before. Who is this ProMed? Well, they're a privately run disease surveillance system out of Boston. I spent some time today digging for their funders and came up empty. If you find them, please tell me. They don't disclose them. They do have several WHO scientists on their board. So that's interesting. And they are a subsidiary of a group called the International Society for Infectious Diseases, ICID, who also does not disclose their funders. They get grants and private donations. They also have WHO scientists on their board. Now, how does ProMed know about clusters of undiagnosed pneumonia in northern China when ProMed is based in Boston? Do they have a global network of doctors that are actually diagnosing patients and seeing patients? They do not. Here is how they tell us they find out about these pandemics. Again, recall they're from Boston, so listen in for that heavy Boston accent.
The Programme for Monitoring Emerging Diseases, ProMed, is a cutting-edge disease surveillance network by the International Society for Infectious Diseases, which provides timely alerts about global infectious disease outbreaks. As an open access and apolitical programme, ProMed provides you fast, near real-time reports about infectious diseases with background commentary by our team of infectious disease experts. So, how does it work? First, our global, multidisciplinary team collects the latest data from sources including healthcare provider reports, laboratory reports, social media posts, news articles, and information submitted directly by our users. Next, these datasets are screened by the ProMed moderators, who are subject matter experts, to validate their authenticity. Once verified, reports are classified to specific regional and topic networks and undergo copy editing and technical review. After a thorough review, the top moderator makes a final decision to distribute the post to over 80,000 people through email subscriber lists, social media, and the ProMed website. Support ProMed today to help us make a difference around the world.
Okay.
That accent, that was probably the Boston accent in 1772, before we held a tea party. I was going to say, like, that's about it.
That's not a Boston accent. I'm glad you got the joke. Some people did not. They're pointing out that that's a posh Welsh accent. I think that if you're trying to establish yourself as like global health organization, you've got to use this British guy as the voice of your,
Like when you go on to hire a voice actor, you want credible and British, because that always like raises the level of intelligence.
Yeah.
They're like, you do not choose American and Boston. No. Like, get out of here.
Don't do that. That's a wicked bad idea.
Yeah, it's a wicked. So we take all these wicked reports and we put them through a thing. And
right. Okay.
Like,
so let's get off the accent, because this is how we're sourcing a pandemic, is an algorithm. Basically, they're not there. They're not in China. China said some words that we can listen to. And also the World Health Organization says that, well, after China, spoke on this, we asked them for some documents. So we're going to review those documents. But for now, we have this online program that will just collate some stuff based on social media and the media. And then we're pretty confident that paints an accurate picture. ProMed also predicted the pandemic, the COVID-19 pandemic. Interesting, right? Because I think we are in agreement that was maybe a chicken or egg phenomenon. Maybe it's something, did they predict it or did they foresee it, right? In a way that they could influence? That's a question we'll leave right out there. Now, again, they haven't been to China. They're just scanning the internet.
Or maybe they're working with Boston University. You remember, as we reported here on the show, and I did a deep dive on Boston University's COVID labs.
Yes, also a good point.
Which were, of course, where they were like literally combining the spike protein from Omicron to the original Wuhan strain. And we didn't know about this, but this was all happening right at Boston University. And who was the big funder behind all of that at Boston University? It was Bill and Melinda Gates Foundation. Right. But that's right there in their neck of the woods. So maybe they can just go down the street.
Okay. Now, here's ProMed's statement about this new infectious disease in China. Sorry, that's too little. You shouldn't be expected to see that. What they're saying now is basically they're scanning the internet and they found that there's overcrowded hospitals with children sick with pneumonia. They have been receiving intravenous drips and have to wait for almost 2 hours to be treated. That's most emergency rooms.
Right.
I don't know.
Wow, that's everywhere.
Yeah, I don't know. Unless you're bleeding or dying, most emergency rooms have long waits like that. But again, they're saying based on our algorithm, we know this. The World Health Organization says, well, ProMed told us and the media, so we believe it. And then we asked China for some extra documents. So they don't know this based on any firsthand source. None, zero. Okay. And then now, so they're saying, well, take some vaccines and also mask up. I do want to address this issue of masks, though, because a new study this week out of Norway found that people who wore masks during the COVID pandemic were more likely to get COVID by 75%. Here is this out for review paper, Association Between Face Mask Use and Risk of COVID. Their summary showing that people who said they use masks either a lot or often were between 30 and 40%. And then when you accumulate those, was over 75% more likely to get COVID. Now, this is a cross-sectional study and based on self-reporting of both mask wearing and COVID. But the authors say it points to the need for further studies about masking, which we're not going to get because the government is never going to apologize that they were wrong. Now, none of this was new to health officials when they insisted on mask mandates. In fact, some studies, we showed you this months ago, suggested that mask wearing could cause the virus to go deeper into the body and cause more severe cases of COVID. And in certain counties, this is called the Fogen effect or Fogen, I'm not sure. In some cases, the counties that had mask mandates had higher COVID deaths, not higher infection rates, but deaths, because they thought that the masks could be pushing the virus deeper into the lungs and cause more severe COVID. And the Norwegian study, in fact, says that this is most likely due to other unobservable things, but no one will study it and give us a real answer. So we have to extrapolate ourselves from reading studies. So I hope I've established a few things here. One, the WHO doesn't know shit about pneumonia in China. They haven't been there and they have no firsthand sources. They just think this from the internet. They're saying vaccine and masks in a foolhardy and almost sort of rote kind of way, even though those things are now unproven to help. It's almost like pandemic Tourette's. Like someone's got a fever, you just yell, masks,
mask,
vaccines, right? And now the third thing I'd like to establish is that China has said that they are going through the same post-COVID virus surge that other countries went through after they lifted pandemic rules. Now, China didn't relax COVID rules last winter, but most Western countries did. The US and Europe had their first full school year without any of those restrictions in place. And because of that, saw a surge in respiratory virus. Look at this chart from the CDC showing how respiratory viruses spiked last fall. This is a year ago from now, right? And had that same spike in respiratory diseases, including COVID, influenza, RSV. Also, pneumonia is not counted on this chart, but saw the same level of spikes. And we see less this year because we went through it. That's a growing pain that happens when you lift pandemic restrictions. That is exactly what's happening in China. And the WHO is freaking out because China. There are, though, some mainstream media organizations willing to say, like, hey, this is what happens. We expected this. Look at this surprisingly honest Bloomberg report saying that this is just a germ and it's China's first post-lockdown winter. We went through it too. Here they're saying this is what it is this myoplasma pneumoniae, which is sometimes called walking pneumonia because it's usually mild, rarely requires hospitalization, but it's making headlines. So, they're saying this is normal and unserious. There is no reports of any serious deaths or excess deaths or spiking rates of deaths. And again, we just don't know because the WHO has no boots on the ground. So how can we trust them when you see these headlines screaming about lockdown and craze in China? You should take it with this context. Let me know what you think of this in the chat.
Fascinating. It's fascinating about ProMed. Yeah, that's crazy. And I love that we just put it through an algorithm, we sift it all down, and then we have a final approval from one of our top moderators.
Yeah.
Before it's disseminated and pushed out to 80,000 email subscribers and shoved down your throats. And then news organizations run with the story.
Yeah, someone's got to find out who their funders are. It just wasn't something that I could have done today, but I'm pretty sure there may not be some up and up people back behind there.
Yeah, let's see if we can track it.
I wonder if Google marks their email as dangerous.
No, it probably got a clean filter right through. They probably have somebody at Google they're friends with, and it gets put right in your inbox as like an important alert about your health and safety from ProMed.
Right.
This is the kind of stuff. And this is, honestly, this is the kind of stuff that local news organizations like West Virginia or Ohio, their local news reports, they'll get this ProMed story into the newsroom, and then they'll do a story in their Health Watch segment.
They'll just read it.
They'll regurgitate it, and this
ProMed says this. And I, like I said, I've been reading pandemic documents now intently for almost 3 years, and I'm like, who the F are they?
When did they get on ProMed?
How come I don't know them? I have not one note on this organization, and they're pretty slippery. That I'm not saying they're bad dudes, but I don't think this is something worth taking to the bank. Like, oh, here's the next pandemic, but that's what the media is telling us. So again,
they want compliance.
Yeah.
Thank you so much for watching this segment here at Redacted. We are live every day at 4 p.m. Eastern time, trying to share the stories that the mainstream media will not cover. You should also come over and join our community of Redacted Rebels over at redacted.inc. That's our private locals community where we can share exclusive content that we simply cannot share here on YouTube. Come over and join the rebellion together right now by going to redacted.inc. We'll see you next time.